Bismillahirrahmanirrahim. Let's see the premenstrual syndrome. Premenstrual syndrome is actually the cyclic recurrence of the physical, psychological, and behavior symptoms before the menses, especially in the luteal phase. So these are symptoms which are associated with the luteal phase or after the menstruation. So they are subside. So these are cyclic, mean they occur in the last phase of the menstrual cycle, mean in the luteal phase or before the menses. If you want to enlist these symptoms which are appreciated in the premenstrual symptom, so if you look at their pool, its pool is almost more than 200 symptom. So but for the diagnosis only one symptom is enough. Okay, so although the 30 to 80% women experience these symptoms which are mild, but if it's severe one, only single symptom is enough for the diagnosis of the premenstrual syndrome. Okay, so let's see the definition: a cyclic recurrence of distressing physical, psychological, or behavior symptom in the luteal phase of the menstrual cycle. So this is like the patient presentation is before the menses she experienced these symptoms. Okay, so in last 2 weeks of the cycle. And the mild symptom which experience with 30 to 90% women, but the severe symptom only 3 to 5%, which is we consider in the premenstrual syndrome. Okay, so behavior symptom, the autonomic, physical, and the musculoskeletal symptoms. So in the behavior like irritability, mood swing, depression, anxiety, crying, nervous tension, forgetfulness. So while in the autonomic, you can consider the fatigue, heart pounding, confusion, dizziness, sleep disturbance like insomnia. So while in the physical, there is abdominal bloating, the breast tenderness, edema in the extremities, and the weight gain. So and in the some the joint related pain or muscle pains, so and headache, cramps. So these are the different symptoms which can be appreciated, but for the diagnosis only one symptom is enough. Okay, so symptom usually experienced in the second half of menses, recurrent, mean more than 3 cycle almost, and disturb the normal life, because mild symptoms are the common in all the women, but the severe if she is disturbing his behavior or the interrelation, so that is considered in the premenstrual syndrome. The International Classification of Disease in its 10th revision mentioned the diagnostic criteria only one symptom is required. Okay, although the pathogenesis is considered unknown, but some theories try to explain its pathogenesis, like the estrogen progesterone imbalance, mean high estrogen, low progesterone, so which impacting the sleep cycle, the mood swing, or the breast tenderness, weight gain, RAS activity, mean the aldosterone activity, which cause the fluid retention, endogenous endorphin deficiency, and endorphin, which is a natural opioid, or which do what it's a mood stabilizer. Prostaglandin excess, which increase the smooth muscle contraction, so which lead to the dysmenorrhea symptom, the breast tenderness, mood changes, cramps, and the bloating. Vitamin deficiency, especially the vitamin B6, vitamin D, so their impact on the regulation of the prolactin. So that's why the high level of prolactin lead to these symptoms. Okay, and the serotonin deficiency, which is also mood stabilizer and associated with the sleep cycle balance. So these are different theories which try to explain the premenstrual syndrome. How we treat the patient when experience these severe symptom. So start with the diet, mean she should take the balanced diet and decrease the caffeine and sugar, salt. Okay, and the lifestyle, I mean regular exercises and the stress reduction, relaxation techniques. So and the support groups. So these activity help out to overcome these symptoms. Okay, in the medical, in the SSRI are the most effective, or you can say first line drugs, so which we use, especially the fluoxetine, so which is commonly used. Combined oral contraceptive, which mean containing the estrogen progesterone equally, like in the monophasic, so preferably used. So it should be continued throughout the cycle, or only in the luteal phase. Okay, and the spironolactone, which is diuretic for the fluid retention, and the NSAID for the joint or the muscle pains symptoms. Okay, and the bromocriptine for breast tenderness, because it's a balance the prolactin level. Okay, and vitamin D and B6 to overcome the vitamin deficiency. Progesterone sometimes used, but it's not as such effective. Okay, what is treatment approach? First line, second line, third line, fourth line. In the first line, you start with the diet plan and the lifestyle changes, so plus low dose SSRI. Okay, and if she not improve, then go for the second line, mean give the contraceptive combined estradiol and the progestin plus high dose SSRI. Okay, and the third line, you think of the GnRH plus the hormone replacement therapy in estrogen progesterone also. Okay, and if she not improving after all these approaches, so then you think of the total abdominal hysterectomy or the bilateral serpingophorectomy plus the hormonal replacement therapy, estrogen, progesterone, the testosterone for their the normal development or the lifestyle. Okay. Okay, so this is a premenstrual syndrome where you experience a lot of symptoms, but for the diagnosis, only one is enough. But if she experiences more than 5 symptoms, okay, then we consider it's a psychiatric disorder. So name of that disorder is the premenstrual dysphoric disease. Okay, which experience the 5% of women PMDD. It's a psychiatric disorder. Okay, for the diagnosis, more than 5 symptoms should be present, and but one core symptom like the irritability, mood swing, depression, and anxiety should present. Okay, so this is criteria set by the Diagnostic Statistic Manual in its fourth edition for the psychiatric disorder. So it's a case for the psychiatric doctor, but the premenstrual syndrome is for the gynecological. Okay, so these are severe symptoms, mean they persist and interfere the daily functioning and the personal relationship. This is all about the PMS and the PMDD. Thank you very much. Allah Hafiz.